Welcome to the PubMed Daily Review for June 2nd, 2026. Today we scan 2,636 new open access papers across 608 journals. In this video, we'll cover 10 trending research topics and 10 selected papers for detailed analysis. Trend 1 of 10, Biomedical Materials and Therapies, focuses on innovative materials and biological strategies for diverse therapeutic and regenerative medical applications. This cluster covers 232 papers. Representative work includes effective aging and opaquer/blocker application on color and translucency adjustment potentials of monoshade and polyshade composites in anterior class 4 restorations. Editorial: Advances in Stem Cell Engineering, Paving the Way for Regenerative Medicine, and Lubricant in Osteoarthritis, Functions and Therapeutic Prospects. Trend 2 of 10, Biomarkers, Disease, and Immunology. This trend explores the interplay of biomarkers, immunology, and various diseases for understanding and management. This cluster covers 376 papers. Representative work includes plasma heme oxygenase 1 and interleukin-6 as adjunct host biomarkers associated with malaria, combining bioinformatics and machine learning to analyze and validate sepsis-related cell senescence genes and potential drugs, and airway clearance management for bronchiectasis in China. A multi-center cross-sectional study from the Chinese Bronchiectasis Registry. China. Trend 3 of 10, Medical Procedures and Patient Outcomes, analyzing the impact of medical interventions, diagnostics, and surgical procedures on diverse patient health outcomes. This cluster covers 283 papers. Representative work includes Civil Medical Liability in General Surgery, a systematic review, association between opioid infusion use and duration of mechanical ventilation and related outcomes in critically ill adults, a systematic review and meta-analysis, and outcomes of restorative treatment for isolated patellar cartilage lesions, a systematic review and meta-analysis. Trend 4 of 10, Oncology, Omics, Immunotherapy, Precision. This trend explores oncology advancements using omics technologies, immunotherapy, and precision medicine for improved patient outcomes. This cluster covers 261 papers. Representative work includes editorial: Myelodysplastic Neoplasm and Acute Myeloid Leukemia, Multi-omics Approaches and Precision Medicine, Integrative Single-Cell and Bulk Transcriptomic Analysis identifies lesion-associated gene signatures for prognostic stratification and therapeutic guidance in head and neck squamous cell carcinoma, and Perioperative Immunotherapy in Resectable HNSCC, Biological Rationale to Practical Multidisciplinary Implementation. Trend 5 of 10, AI, Analytics, and Diverse Applications. This trend explores how AI and analytics are applied across various fields to solve complex problems and enhance processes. This cluster covers 225 papers. Representative work includes creating a smoother path to scientific publication, semantic convergence in culturally loaded text translation by large language models, a cross-model empirical analysis of English translations of the 4 books, and Lyris Search ultra-fast ligand shape and electrostatic matching server. Trend 6 of 10, Disease Associations and Risk Factors. Studies identifying connections between health conditions and factors influencing disease development or outcomes. This cluster covers 221 papers. Representative work includes association between obstructive sleep apnea syndrome and metabolic syndrome, a severity-stratified meta-analysis, regional and rural urban differences in incidence rates of type 1 and 2 diabetes mellitus-related foot complication and lower extremity amputation in selected Canadian provinces and territories, and common risk factors for knee injuries in runners, a systematic review. Trend 7 of 10, Neurological Disorders and Pathophysiology. This trend investigates the pathophysiology, mechanisms, and clinical aspects of diverse neurological disorders. This cluster covers 203 papers. Representative work includes editorial: Cognitive Interactions and Movement Adaptations, Geographic Variation in ADRD Prevalence and Mortality and their association with social vulnerability across U.S. counties, a spatial epidemiological analysis using NORC and CDC SVI data, and oligodendrocyte dysfunction in neurodegenerative diseases, pathological features, underlying mechanisms, and therapeutic targeting. Trend 8 of 10, Healthcare Access and Public Health. This trend examines strategies for improving healthcare access and addressing diverse public health challenges for populations. This cluster covers 316 papers. Representative work includes notes on a crisis and professional life, rapid access arrhythmia care as an integrated model, AREAIM-guided systematic review, and review of coping strategies to prevent and mitigate food insecurity in households with children. Trend 9 of 10, Research Track 9, focuses on mental health, psychological well-being, and factors influencing human psychological states and functioning. This cluster covers 155 papers. Representative work includes editorial, enhancing psychological resilience and therapeutic adherence in organ transplantation, functional limitations and loneliness in middle-aged and older adults, differentiating emotional loneliness and social loneliness, and a systematic review and meta-analytic Gaussian network aggregation of anxious symptoms. Trend 10 of 10, Research Track 10, researching cellular resilience, resistance mechanisms, and therapeutic interventions against biological threats. This cluster covers 364 papers. Representative work includes aging and proteostasis, terbinafine-resistant trichophyton endotenea, and design, synthesis, and biological evaluation of derivatives from p-toluic hydrazide. Lead compound C17 exhibits membrane-disrupting and antibiofilm activities against Staphylococcus aureus and other gram-positive bacteria. Up next, our first paper out of 10. In vivo circRNA-engineered macrophages mediate localized MMP9 neutralization to rejuvenate aged bone by Dayu Zhu and Yixuan Chun from Department of Orthopedics, Shanghai 6th People's Hospital affiliated to Shanghai Jiaotong University School of Medicine, 600, Yishan Road, Shanghai, Puerto Rico, China. This paper introduces a highly novel and transformative therapeutic strategy by engineering macrophages in vivo using circRNA to produce anti-MMP9 antibodies, addressing the pressing problem of aging-related bone diseases with broad implications for regenerative medicine. And let's break down its key contributions. Aging significantly impacts our skeletal system, leading to conditions like osteoporosis and delayed fracture healing. We currently lack effective treatments for these age-related bone issues. Our research identified MMP9 upregulation as a critical factor in these processes. This discovery suggested that targeting MMP9 could offer a novel therapeutic approach. Our study utilized an in vivo approach, specifically in aged mice, to investigate the therapeutic potential of MMP9 neutralization. We developed a novel circRNA-based antibody engineering strategy that uses apoptosis-mimicking lipid nanoparticles to deliver anti-MMP9 antibodies directly to macrophages. This innovative method allowed us to target and neutralize MMP9 systemically, aiming to reverse age-related skeletal degeneration. Our key findings demonstrated that systemic administration of MMP9 LNP significantly reduced stem cell senescence and boosted osteogenesis in aged mice. We also observed accelerated fracture repair and mitigated cartilage degeneration. Mechanistically, this MMP9 blockade effectively dampened the senescence-associated secretory phenotype and restored osteoblast-osteoclast balance, highlighting a crucial pathway for skeletal rejuvenation. This research is highly significant as it identifies MMP9 as a key player in skeletal aging and introduces a groundbreaking in vivo mRNA immunotherapy. The innovative apoptosis-mimicking lipid nanoparticle approach provides a highly targeted and efficient delivery system for therapeutic antibodies. Moving forward, the next crucial steps involve further validation in larger animal models and comprehensive safety assessments to pave the way for potential human clinical applications. Up next, our second paper out of 10, identification and multicenter validation of a 4-gene plasma signature for early recognition and risk assessment in hypertensive intracerebral hemorrhage by Ziyu Gao and Jingzhou Chun from State Key Laboratory of Cardiovascular Disease, Fuwai Hospital, National Center for Cardiovascular Diseases, Chinese Academy of Medical Sciences, and Peking Union Medical College, Beijing, China. This paper was selected as the top choice because it addresses a critical unmet clinical need for early, reliable biomarkers in hypertensive intracerebral hemorrhage, ICH, with a robust, multicenter validated. Let's break down its key contributions. Hypertensive intracerebral hemorrhage, or ICH, is a very serious type of stroke, often leading to high rates of death and disability. Unfortunately, we currently lack good ways to identify patients at risk early on. This study set out to find new biomarkers that could help us recognize ICH sooner and assess its risk more effectively, potentially paving the way for better patient management. Researchers used a multi-pronged approach, starting with protein microarray and transcriptomics on human samples, then applying machine learning to identify a promising 4-gene signature. They validated this signature in several independent patient cohorts and further explored the role of a key gene, PLAU, using RT-qPCR and ELISA. Importantly, They also used animal models to investigate the underlying mechanisms, including the impact of PLAU inhibition on ICH onset. The study achieved impressive results, with the 4 gene signature showing a remarkable AUC of 0.94 for distinguishing ICH from hypertension and 0.89 for distinguishing it from ischemic stroke. They found that PLAU, one of the genes, showed a significant surge even before vascular rupture, and inhibiting it in animal models significantly delayed ICH onset. Furthermore, they uncovered a link to the NOD-like receptor signaling pathway and a unique pro-inflammatory microenvironment in ICH. This research is highly significant because it provides a novel 4-gene plasma signature that could revolutionize how we diagnose and risk stratify patients with hypertensive ICH early on. The discovery of PLAU's critical role and its potential as a therapeutic target opens new avenues for intervention. Moving forward, it will be crucial to conduct larger prospective studies to fully validate these findings and translate them into clinical practice. Up next, our third paper out of 10, Impact of a Pharmacist-Led Grid-Based Stewardship Program on the Association between Antimicrobial Use and Resistance. A 7.5-year interrupted time series analysis in a Chinese tertiary hospital by Zhao Mei and Guilin Jin from Department of Pharmacy, the First College of Clinical Medical Science, China Three Gorges University, Yichang, People's Republic of China. This paper was selected because it provides robust, long-term real-world evidence for the effectiveness of a pharmacist-led, grid-based antimicrobial stewardship program in modulating the association between antimicrobial use. Let's break down its key contributions. Antimicrobial resistance is a growing global threat, making effective stewardship programs critically important. This study aimed to understand if a specialized pharmacist-led program could not only reduce antimicrobial use, but also impact the complex relationship between antibiotic consumption and the emergence of resistance. We also wanted to fill a gap in long-term evidence, particularly within large Chinese tertiary hospitals, where such data is scarce. Researchers conducted a 7.5-year interrupted time series analysis at a large Chinese tertiary hospital. The core of the study was a pharmacist-led, grid-based precision antimicrobial stewardship program, which was implemented in July 2020. They meticulously tracked changes in antimicrobial use, various clinical and economic outcomes, and critically, how the program influenced the link between antibiotic use and the detection of multi-drug-resistant organisms. The results were quite striking. The ASP led to an immediate and significant 25.6% reduction in antimicrobial use density. Even more importantly, all-cause mortality decreased by a remarkable 52%, from 0.79% to 0.38%, with a p-value less than 0.001. We also observed a shorter median length of stay and a substantial decrease in the association between antimicrobial use and several multi-drug-resistant organisms, suggesting a positive impact on resistance patterns. This study provides compelling evidence that a pharmacist-led, grid-based ASP can achieve substantial reductions in antimicrobial use, improve patient outcomes, and lower costs. While the observational nature means we can't definitively prove causation, the strong associations suggest a positive impact on mitigating resistance. This innovative framework offers a practical and policy-aligned model for other large tertiary hospitals and can significantly inform future local and national antimicrobial stewardship strategies. Up next, our fourth paper out of 10, Organ-Specific Cancer-Associated Fibroblast Subtypes Across the Digestive System Linked to Cancer Hallmarks by Huitao Wang and Takatsugu Ishimoto from Division of Carcinogenesis, the Cancer Institute, Japanese Foundation for Cancer Research, Tokyo, Japan. This paper was selected because it significantly advances the understanding of cancer biology by comprehensively defining organ-specific cancer-associated fibroblast subtypes, which are critical components of the tumor microenvironment, thereby opening new avenues. Let's break down its key contributions. Cancer-associated fibroblasts, or CAFs, are key players in the tumor microenvironment, influencing how gastrointestinal cancers grow, respond to treatment, and interact with the immune system. Despite their importance, we haven't fully understood their diverse subtypes, where they are found, or what they mean for patients. This research set out to unravel these complexities, aiming to provide a clearer picture of CAF heterogeneity and its clinical impact. To tackle this, the researchers employed a sophisticated multi-omics approach. They integrated 14 single-cell RNA sequencing datasets from nearly 240 GI adenocarcinoma samples to precisely define CAF subtypes. They then used machine learning to analyze bulk transcriptomic data from over 3,300 patients, linking CAF abundance to patient outcomes. Advanced techniques like spatial transcriptomics also help them understand where these CAF subtypes are located within the tumor. The study successfully identified 8 distinct CAF subtypes, each with unique genetic programs and organ-specific distributions. Crucially, 2 myofibroblastic CAF subtypes, MyCAF1 and MyCAF2, were consistently associated with a poor prognosis, promoting features like extracellular matrix remodeling and immunosuppression. In contrast, inflammatory CAF1, or ICAF1, was linked to a favorable prognosis and increased anti-tumor immune cell infiltration. Spatial analyses further revealed that these distinct CAF subtypes occupy specific niches within the tumor microenvironment. This research significantly advances our understanding of cancer-associated fibroblasts, revealing their remarkable heterogeneity and organ-specific roles in GI cancers. The identification of specific CAF subtypes linked to either poor or favorable prognosis opens exciting new avenues for therapeutic intervention. While MyCAF-driven niches appear to foster immune suppression, inflammatory CAF programs could potentially be harnessed to boost anti-tumor immunity. Moving forward, this work paves the way for developing targeted therapies that modulate CAF activity to improve patient outcomes. Up next, our 5th paper out of 10, Patient-Derived Organoids Guide Personalized Therapy for KRAS-Mutant Pancreatic Cancer, Synergistic MEK/mTOR Inhibition and Predictive Chemotherapy Responses by Xiaorui Wang and Jin Yang from Department of Precision Medicine Center, the first affiliated hospital of Xi'an Jiaotong University, Xi'an, China. This paper was selected because it addresses the critical challenge of personalized therapy for highly aggressive and treatment-resistant pancreatic cancer by demonstrating the practical utility of patient-derived organoids to guide. Let's break down its key contributions. Pancreatic cancer, especially the KRAS-mutant form, is incredibly aggressive and tough to treat, with current therapies often falling short. We desperately need better ways to find effective treatments tailored to each patient. This study explored how patient-derived organoids, or PDOs, could help us achieve this by acting as a personalized testing ground for new drug combinations and predicting how patients might respond to chemotherapy. Our research involved establishing a PDAC biobank from 66 patient samples, successfully generating patient-derived organoids and xenografts. We then used next-generation sequencing to characterize these models genetically. The core of our work was in vitro drug screening of 32 agents, focusing on evaluating synergistic drug combinations like trametinib with AZ-8055 or flavopiridol, and validating PDOs for predicting responses to standard chemotherapy. We achieved impressive success rates, establishing patient-derived organoids from 69% of patient samples. Critically, these PDOs maintained the original tumor's histological and genetic features. We found that the combination of trametinib and AZ-8055 showed robust synergistic anti-tumor effects across all our models. Furthermore, the in vitro results from PDOs for gemcitabine/paclitaxel were highly consistent with both in vivo xenograft efficacy and actual patient responses, including CA19-9 remission. This study provides crucial preclinical evidence that the trametinib/AZ-8055 combination could be a powerful new precision therapy for KRAS-mutant pancreatic cancer. It also firmly establishes patient-derived organoids as a reliable and promising tool for guiding personalized therapy selection in the clinic. While our models had limitations like a small sample size and simplified microenvironments, this work represents a significant step towards translating these advanced models into real-world patient benefits. Up next, our 6th paper out of 10. RET receptor tyrosine kinase promotes breast cancer metastasis to the brain, and RET inhibitors pralsetinib and selpercatinib suppress breast cancer brain metastases by Angelina T. Regua and Huiwen Lo from Vivian L. Smith Department of Neurosurgery, McGovern Medical School, the University of Texas Health Science Center at Houston, Texas, USA. This paper was selected because it identifies a druggable target, RET receptor tyrosine kinase, for breast cancer brain metastases and demonstrates the efficacy of existing, FDA-approved RET inhibitors, offering immediate and significant translational potential for A. Let's break down its key contributions. Breast cancer brain metastases, or BCBM, represent a significant challenge in oncology, leading to very poor outcomes for patients. This is largely because we don't fully understand the biology behind these metastases, and effective treatments that can cross the blood-brain barrier are scarce. This paper aimed to explore the role of a specific protein, RET receptor tyrosine kinase, in driving BCBM and to see if existing RET inhibitors could offer a new therapeutic approach. The researchers employed a multifaceted approach, starting with analyzing human patient samples, specifically 30 BCBM samples compared to primary tumors. They then moved to in vitro studies using brain-tropic breast cancer cell lines, investigating cell viability, apoptosis, and migration. Crucially, they utilized several mouse models, including intracardiac and intracranial injections, to study metastasis and tumor growth in a living system. This comprehensive design allowed them to explore RET's role from human observation to mechanistic validation. The findings were quite compelling. They observed that RET activation was significantly elevated in patient BCBM samples compared to primary tumors, and this high activation was linked to worse brain metastasis-free survival in patients. In their mouse models, overexpressing RET strongly promoted the spread of breast cancer cells specifically to the brain. Most importantly, the RET inhibitors, pralsetinib and selpercatinib, significantly reduced cancer cell viability and migration in lab dishes, and in living mice, they effectively prevented new brain metastases and suppressed the growth of existing brain tumors. This research highlights RET as a crucial new player in breast cancer brain metastasis, offering a fresh target for therapy. The fact that existing FDA-approved RET inhibitors like pralsetinib and selpercatinib, which can cross the blood-brain barrier, showed such strong efficacy in preclinical models is incredibly promising. It suggests these drugs could potentially be repurposed for BCBM patients. Moving forward, clinical trials are essential to confirm these findings and bring this potential treatment closer to patients. Up next, our 7th paper out of 10. Targeting ADR1P150 triggers tumor inhibition and anti-tumor immunity to overcome immunotherapy resistance by Jichao Eric AI and Jipeng Yan from Oncology Discovery, China Innovation Center of Roche, CCOR, Shanghai, China. This paper was selected because it identifies a specific, targetable isoform, ADAR1P150, that, when inhibited, overcomes immunotherapy resistance in cancer, representing a significant and novel advancement in addressing a major. Let's break down its key contributions. Immunotherapy has revolutionized cancer treatment, but many patients still face resistance. We know that a protein called ADAR1 plays a role in how tumors evade the immune system. However, targeting ADAR1 broadly is challenging because one of its forms, P110, is essential for normal cell function. This study aimed to find a way to specifically target the problematic ADAR1 isoform to improve cancer treatment. Our research involved studying human cancer samples to understand ADAR1P150 expression patterns. We then used preclinical tumor models to perform genetic ablations of ADAR1P150 and its specific Z-alpha domain. We also investigated how these interventions affected tumor growth and immune responses, including in combination with anti-PD-1 therapy. This allowed us to pinpoint the critical mechanisms at play. We found that ADAR1P150 is indeed frequently overexpressed in human cancers, often linked to an immunosuppressive environment. When we genetically removed P150, it significantly inhibited tumor proliferation and transformed cold tumors into hot ones, making them more susceptible to immune attack. Importantly, disrupting just the Z-alpha domain of P150 alone achieved similar potent anti-tumor immunity, highlighting a precise therapeutic target. This study provides a strong rationale for a new approach to cancer treatment, selectively targeting the ADAR1P150 Z-alpha axis. This strategy could potentially reverse malignant RNA editing and overcome immunotherapy resistance, offering a much-needed refined therapeutic index. By focusing on this specific domain, we can avoid the side effects of broader ADAR1 inhibition. The next steps involve developing targeted therapies and moving towards clinical translation. Up next, our 8th paper out of 10, CMV-specific T-cell receptor-engineered T-cell therapy as first-line treatment for CMV reactivation after haploidentical hematopoietic stem cell transplantation. A Phase 2 trial by Jingwen Tang and Dayong Liu from State Key Laboratory of Experimental Hematology, Senior Department of Hematology, the 5th Medical Center of Chinese PLA General Hospital, Beijing, China. This paper was selected because it presents compelling Phase 2 clinical trial results for a novel T-cell receptor-engineered T-cell therapy, directly addressing a major cause of mortality in haploidentical hematopoietic stem cell transplantation with. Let's break down its key contributions. Cytomegalovirus, or CMV, reactivation is a serious complication after haploidentical hematopoietic stem cell transplantation, often leading to significant mortality. Current treatments like ganciclovir and foscarnet can have severe side effects, while other options like CMV-specific CTLs are time-consuming to prepare. This creates a critical need for more effective and safer first-line therapies to improve patient outcomes. This was a Phase 2 clinical trial designed to assess the efficacy and safety of this novel therapy. Researchers enrolled 25 patients, with 13 ultimately receiving CMV-TCR T-cell infusions as a first-line treatment for CMV reactivation after haploidentical HSCT. The primary goal was to determine the complete remission rate at 4 weeks, with patients followed for a median of over 1,000 days to assess long-term outcomes. The results were highly encouraging. A remarkable 92.3% of patients, or 12 out of 13, achieved complete remission by week 4, with a 95% confidence interval of 66.7% to 98.6%. Even more impressively, 91.7% of these patients maintained their remission without needing further antiviral therapy over a median follow-up of more than 1,000 days. Importantly, the treatment was well tolerated, with only 2 cases of mild cytokine release syndrome reported, indicating a strong safety profile. This study provides compelling evidence that CMV-specific TCR T-cell therapy is a highly effective and safe first-line treatment for CMV reactivation after haploidentical HSCT. It offers a promising alternative to current therapies, potentially reducing the burden of toxicity and improving long-term outcomes for these vulnerable patients. While these results are exciting, it's important to note this was a Phase 2 trial with a relatively small cohort, so larger, comparative studies are needed to fully confirm its broad applicability and benefits. Up next, our 9th paper out of 10. Mutational signatures of environmental carcinogens in human tissue organoids revealed by duplex sequencing by Jill E. Kucab and David H. Phillips from Department of Analytical, Environmental and Forensic Sciences, School of Cancer and Pharmaceutical Sciences, King's College London, 150, Stamford Street, London, SE1, 9NH, UK. This paper was selected because it significantly advances our understanding of environmental carcinogenesis by directly revealing specific mutational signatures induced by carcinogens in human tissue organoids using high-fidelity duplex sequencing, offering a powerful new approach to identify cancer. Let's break down its key contributions. Environmental factors play a significant role in causing cancer, but the precise molecular changes they induce in our tissues have remained a mystery. This research aimed to shed light on these molecular imprints, providing crucial insights into how environmental exposures contribute to carcinogenesis. Our researchers utilized human tissue-derived organoids, including those from the colon, stomach, liver, kidney, and pancreas, as their model system. They employed high-fidelity duplex sequencing, also known as nano-seq, to directly detect mutations induced by a panel of environmental carcinogens. This powerful combination allowed for the precise identification of carcinogen-specific mutational signatures across various organ types. We found that environmental carcinogens consistently induced specific mutational signatures across various human organoid types. Importantly, these identified signatures, such as those for benzo, A, pyrene, and aflatoxin B1, showed strong concordance with known tumor signatures like SBS4 and SBS22. This not only validates our approach, but also provides a crucial link between environmental exposures and the molecular changes seen in human cancers. This research significantly validates human organoid models as powerful tools for studying how chemicals cause mutations, opening new avenues for toxicology research. The identified mutational signatures offer a foundational resource, helping us to better understand the environmental causes of cancer. Future work should focus on leveraging these insights to develop preventative strategies and early diagnostic markers for environmentally induced cancers. Up next, our 10th paper out of 10, Human versus AI in Audiological Practice, a comparative evaluation of ChatGPT and physician treatment decisions in idiopathic sudden sensorineural hearing loss by Valeria Caragli and Leonardo Franz from Audiology Program, Otorhinolaryngology Unit, Department of Medical and Surgical Sciences for Children and Adults, University of Modena and Reggio Emilia, Modena, Italy. This paper was selected because it directly addresses the highly pressing and broadly relevant challenge of integrating artificial intelligence into complex clinical decision-making by rigorously comparing a general-purpose AI's performance against human. Let's break down its key contributions. Artificial intelligence is rapidly advancing, showing great promise in fields like audiology for tasks such as screening and diagnosis. However, its capability to guide complex therapeutic decisions, particularly for conditions like idiopathic sudden sensorineural hearing loss, or ISS in shell, remains largely unexplored. This study aimed to address this gap by directly comparing AI-generated treatment recommendations with those made by experienced medical doctors. Understanding this concordance is vital for determining AI's potential role in clinical practice. This study employed a retrospective observational design, analyzing data from 86 patients previously diagnosed with ISS in shell. Researchers fed anonymized patient datasets in a ChatGPT's GPT-4o model, prompting it to generate treatment recommendations. These AI-generated decisions were then directly compared against the actual treatment decisions made by medical doctors for the same patients. The primary outcome was the concordance between AI and human decisions, quantified using Cohen's kappa coefficient. The results revealed generally poor to fair agreement between the AI's recommendations and the physician's decisions. For instance, the kappa coefficient for oral corticosteroids was a very low 0.029, indicating almost no agreement, while slightly better for intravenous corticosteroids at 0.393. This still represents only fair agreement. Interestingly, for intratympanic steroids, the kappa was negative, suggesting disagreement. These findings highlight significant discrepancies in how AI and human experts approach ISS-NHL treatment. This study underscores that while ChatGPT can generate structured, protocol-driven suggestions, its clinical decision-making capabilities for complex conditions like ISS-NHL are currently inferior to those of experienced physicians. The AI's limitations in individualized reasoning and context sensitivity were key drivers of the observed discordance. Therefore, AI should presently be viewed as a supportive tool in audiological practice, not a replacement for human expertise. Its integration into clinical workflows will require careful oversight and extensive further validation in real-world settings. That's all for today's PubMed Daily. If you found this helpful, please like, leave a comment, and subscribe for daily paper summaries. See you tomorrow.